let's say a patient comes to you and says, "Oh man, my knee really hurts." What is the process that the patient should think through and you think through about understanding what things can be done before a joint replacement, or if this patient is a candidate for a joint replacement?
Yeah, so I'm going to address that as two questions. The two questions were, what are the treatment options for someone, let's just say, with hip or knee arthritis? And then the second question would be, how do I think of somebody as becoming a candidate for joint replacement surgery? So the way I describe the options, I usually tell patients that if you have hip or knee arthritis, there are basically three things you can do, three types of things. The first two types of things are ways to manage your symptoms. So they're not changing anything about your hip or your knee. They're ways to manage the symptoms. The first category is medication. So simply oral, topical, or injected medication. Medication treats pain typically and has some typical amount of duration that it lasts for, and at that point would then wear off, and most likely you'd experience pain similar to how it was before you had the medication. And that's true whether it's a pill, whether it's a topical medication, or whether it's a shot. Second thing you can do is you can figure out ways to put less force on your joint. So if you've got a bad hip or a bad knee and you put less force on it, it should hurt you less. Not going to change your hip or your knee, but hopefully it will feel better. You can lose weight. Obviously, that puts less force on your joint. When you walk on level ground, there's probably 3 to 4 times your body weight through your hip or your knee, and up and down stairs is probably more like 10 or 11 times your body weight. So you can see how each pound would really make a difference. Strengthening muscles that cross a joint, if they are stronger, will cause less force to go through that joint. Sometimes bracing, especially for knee arthritis, can help take pressure off the joint. And then lastly, if you avoid certain activities. I'll have a patient who comes in and says, I'm doing pretty well except for when I run or except for when I play basketball. Even if that's something that patient loves to do, if that's the only thing that bothers them, they could choose as treatment finding an alternative to that one activity. And then the third and final thing is hip or knee replacement. And that's the only category would actually change the inherent process or problem in the joint. So that second part of the question is, when do I think someone's a candidate for those surgeries? And pretty simple. Barring any rare medical conditions or other things that would preclude a patient from being a candidate, I usually tell patients you are a candidate if you have pain from loss of cartilage in the hip or the knee, and that pain is not adequately addressed by any of the non-surgical treatments that I mentioned. And ultimately, the patient's the only one that can decide when that is, because they are the only person in the world who knows how bad their hip and knee symptoms are.